Hi, everybody. It's Cliff, and this is Life with MS. Today, I have someone very special on the show. I'm super excited to have her because she's just this awesome wealth of knowledge. If you've been struggling with finding some mental health, some mental health help with your MS, you're going to want to watch this. So we're going to get started here right now. I want to introduce to you Dr. Meghan Beier, and I'm going to read off here, even though my optic neuritis is just like off the charts today. So I'm kind of, but we can do that here.
Yes, exactly.
You understand.
Accommodate.
I don't have to explain it too much, which is really nice. Dr. Meghan Beier is a health and rehabilitation psychologist at the Rowan Center for Behavioral Medicine and with a specialized expertise in multiple sclerosis. That's very important. We'll talk about that in a second. And other neurological disorders, chronic illnesses, disabilities, and rare conditions. Dr. Beier is a prominent figure in the field, featured in major publications, and invited internationally as a keynote speaker and consultant for organizations like the MS Society. In fact, that's how I found her. I think I found you on another publication as well, but your information is getting out there, and that's awesome. Dr. Beier's research focuses on neuropsychological outcomes in MS, cognitive rehabilitation, and behavioral wellness. Driven by a passion to improve care, Dr. Beier founded findempathy.com. That's going to be very important to this conversation here in a moment. It's a free directory of mental health providers specializing in medical populations, which also offers a podcast and continuing education for professionals. She holds a Ph.D. from Yeshiva University and completed a fellowship at the University of Washington, focusing on MS rehabilitation. And before her current role, she held faculty positions at the University of Washington and Johns Hopkins University, where she established the MS Rehabilitation Research Program and Psychology Clinic. She continues her research and teaching as an adjunct faculty member at Johns Hopkins. So, Dr. Beier, thank you so much for taking the time out today. I know you've got a crazy busy schedule. I see all the stuff you do. I follow you closely, not in a stalker way, but I love the information you're putting out there. And I just think some of it's so valuable. And I'll just kind of tip off real quick here with basically saying the reason I reached out to you is, how do I say this nicely? We do a great job here in the States of coming up with great medications to stop the progression of MS or to help with the symptoms of MS. But one thing I don't think we're doing really well right now, or have ever done really well, and this goes back to my wife having cancer. This is what we experienced there as well, is we don't really address the mental issues that come with these chronic conditions, at least in my experience and other people I speak with. And I find that to be 95% of my battle day to day is dealing with the condition of multiple sclerosis from a mental perspective. Like, it really is a gnarly mind game. And we just don't have the tools to, or at least we don't know about them, to deal with this. Or, I can go get an infusion and I'll be okay, physically for a while. But mentally, I'm kind of a hot mess. MS affects every part of my life. So it's just kind of a disaster. And I know that happens to a lot of people, especially the more progressed their MS is, the more they're dealing with depression, they're dealing with anxiety, they're dealing with family issues, they're dealing with relationship issues in terms of they have a caregiver in their house who just does not understand what they're going through. And I didn't understand the value of the tool set until I found, after 10 years, psychologist and social worker who understood multiple sclerosis because they worked in a multiple sclerosis clinic. And after 10 years of being with other psychologists and psychiatrists and getting just really crazy different diagnoses that had nothing to do with MS, I didn't know I had MS at the time. I think someone that's a professional that has familiarity with MS could look at it and go, oh, you might be dealing with more than just depression and anxiety here. For example, I was losing my eyesight, and my psychologist, who didn't know anything about MS, was saying, well, you're just getting too angry. Your blood pressure is going up and you're seeing red. And I'm like, no, I'm actually not. It's completely going away and not coming back. So I came up with a list of 4 questions here. I want this to be a tool set for people to be able to use to go out and find that mental help that is going to basically understand the quirkiness and the nuances of multiple sclerosis. And I got to say, I've read a lot of your articles, the recent one on Can Do MS about anxiety, and you're spot on from my, and of course I'm not a professional. I'm just a bald dude on YouTube with MS, dealing with it every single day, which I guess anybody with MS kind of, it makes us a professional at that point, right? If we're dealing with it all day long.
I think you are professional. You live with it day in and day out. So yeah.
Right, right. So I just said a mouthful. But again, welcome to the show. And I just really am appreciative of your time. And I wanted to hop into some questions here. So, first and foremost, and I'm kind of going out of order from the questions I sent you here, but here's the biggest challenge I found as someone with MS and my wife being a caregiver when I have really bad relapses and stuff is how do we go about finding someone that can help us with the mental issues and all the struggles we chase cognitively, or all the struggles we deal with cognitively, um, that has familiarity with MS? Because I have and have had a very difficult time finding that. And I know you came up with a resource for that, and I'm going to let you speak to that. And that's one of the reasons I reached out to you, because obviously you identified this.
Yeah. What you're speaking to is the Find Empathy directory, which the whole reason I started that actually was because I had a patient who was sitting in front of me one day and um, had visited Johns Hopkins from out of state. And at the time we didn't have telemedicine. It was pre-COVID, and was looking for a mental health professional that had that MS experience. Because when she sat in front of me and we did our neuropsych eval, and she started to explain something to me, and then I sort of said, "Oh no, I understand this," and kind of filled in the blank. And she was like, I don't have to like tell you what this stuff is or the medications that I'm on or what fatigue means. And she was like, how do I find somebody like you? And it's very hard to find psychologists or mental health providers that have that experience and background. And so I wanted to create a directory. I will say that the directory is not as full as I would like it to be. So I'm still in the works of trying to get more people to join it. But the whole goal with that is to only have people on there that understand medical conditions and that they work with a certain percentage of people in their practice. So if they list MS, it has to be a certain percentage of their practice, so that we know that they are working with people and truly understand the diagnosis. So outside of that, I'll share some other resources. The National MS Society they have a resource directory as well, where they do vet some psychologists and mental health providers. I will say I saw some latest numbers, and I think there's only like 15 to 20 psychologists in the country on their list too. But I think they are a good resource. If you find a MS clinic that does have mental health attached to it, so there are a few around the country, Johns Hopkins, Cleveland Clinic, Seattle, University of Washington, Holy Name Hospital in New Jersey, and there's more. There is something called PSYPACT now, so that if a psychologist is part of PSYPACT, you can see them across state lines as long as your state is part of PSYPACT. So right now there's over 40 states that are part of that. So I see people all over the country, and my colleagues in other places are doing the same. So that's a really great resource. Don't just stick to your hometown. Really cast the net wide, and look at some of those other MS centers around the country. See if they have a psychologist and call them up and see if they can see you virtually through PSYPACT. And finally, I would say there's the APA, the American Psychological Association, has different divisions that they specialize in different topics. So there's a health psychology division, there's a rehabilitation psychology like PM&R psychology, there's neuropsychology, and there's more. But if you wanted to look for people that are part of those divisions, you can go to the American Psychological Association, find health psychology, rehabilitation psychology, or neuropsychology. All of those psychologists have been specially trained to either work with health populations or neurologic populations or rehab populations, people who, are seeing PTs, OTs, speech pathologists, things like that. So I hope that will give you at least a starting point to find somebody that maybe has some MS experience.
Yeah, that's great information, and I will link all that stuff you're talking about in the description below. Now, this actually begs one more question that I think is interesting. First of all, I didn't know about the PSYPACT thing. That's amazing because the psychologist I was working with was in Texas. I moved out of Texas to North Carolina, and we kind of had to sever that relationship. He was the best. It was mind-boggling to see what you could do with this disease once you had the tools mentally to dig into the box and go, okay, I'm not going to let my brain go into lizard program and kind of like start going into the anxiety. Of course, you can't avoid all of it, but he did a thing with me just as an example where basically he said, okay, don't reply back to anybody that asks about your MS until you give yourself a 5 to 10 second break to think about your answer. Like, look at the environment, think about who you're talking to before, because at one point I was just getting super frustrated with people. I would say, oh, I have multiple sclerosis. That's why I'm not out doing this and that today. And they would be like, oh yeah, I've got a cousin with MS and they're doing fine. They're not on medication. I'm like, oh, you don't understand, right? It was that kind of thing. So, so the fact that whole environment or the whole, there's a much larger resource pool now, it sounds like. Now, the question I want to ask about that is should someone with MS who's seeing a neurologist expect for a neurologist to know of providers like psychologists?
It's a good question. I think if you're in an academic medical center or one of those sort of comprehensive MS centers, they're supposed to. They're supposed to have somebody, especially if they're in National MS Society partner in care. They're sort of required to have somebody that does mental health as part of that. So they should know somebody in the community. I would say as you move further away from those academic medical centers, which, as we know, the majority of people in the country probably do not have access to, it's maybe less and less likely. So they might have a social worker or a psychologist that they know of in the community, but those individuals may not know MS specifically. So I think that they're looking for providers just as much as we are sometimes. And so I would ask your neurologist, because they might have somebody that they've heard from another patient who, we really like this person, or I worked with this person, they were really great, and they might kind of put them on their resource list. But I wouldn't be surprised if you ask and they're not sure, they don't have somebody specific.
Okay, that's really interesting. I found that my neurologists that are associated with universities usually have a decent answer, and the ones that are private practice, and this has happened more than several times, that are like, yeah, sorry, there's really nothing we can do about that. And they're usually apologetic because they realize there's a huge mental component to this game, especially if they've been in it a long time. So hopefully that starts changing, and hopefully the resources like findempathy.com start encouraging that. And I know that getting that stuff up and moving early on is difficult, and to get momentum behind it, but we've really got to do it. And that's one of the reasons I wanted to have you on the show here, because I think it's just so important. There's just a lot of things that we think about from day to day with this disease that just can't be fixed with medication. Like, it really comes from the inside. But we got to be able to have the tools to deal with that. And I got to tell you, before I was seeing my psychologist with an MS background, I was a hot mess. It was just, I didn't know how to deal with it. I didn't know how to deal with the fatigue. I didn't know how to deal with the cognition issues. I didn't know how to deal with the job loss issues. The fact, just all these things that put a lot of stress on an individual and a community. So I'm hoping we start seeing more accessibility to these types of services. All right, let's move on to the second one here. Okay, so let's say theoretically I find a psychologist or a psychiatrist or a mental health provider that I really like, who does understand something about multiple sclerosis. One thing I have found as a person who has gone through a lot of therapists, looking for the right person for the right personality match and all this stuff, is I've often walked away prematurely from those first or second meetings with that expert and realized I didn't ask the right questions. So I didn't really have the right information to continue that relationship. So I just kind of continued that relationship. And ultimately, those sessions didn't really amount to much. What kind of questions should someone with MS ask a therapist in their first meeting to kind of sum up whether that could be the right person for them or not? Like what indicators are we looking for as a patient?
Sure. Yeah. That's a really good question. I would say personality match is a big one. That would say there's some research to show that if you don't trust the person or you don't feel connected to them emotionally in some way, that you're unlikely to get benefit from that relationship. So what I would say is number one, if within the first 3 sessions, I often tell people this even when they're meeting with me for the first time. If after session number 3, you're not really feeling super connected or you're not feeling like you're getting something from those first 3 sessions, I would end that relationship and move on. I think that you're going to start to notice whether or not you're thinking about what they said or that you're getting something from the sessions after at least the 3rd session. The first one's usually just trying to figure out, what the needs are, what your background is, kind of get to know each other. Second one, you're starting to get into some of goal setting, and by the 3rd one, you should be really sort of getting to work. So I think that's why I say session 3. Other than that, I would say asking about how they approach challenges or what their theoretical orientation is can be really helpful. So often I will ask patients in one of those first 3 sessions, if in 6 months from now you were to call this successful, what would that look like? So what goals are we trying to accomplish? And if your goals are not aligned to their areas of expertise or the theoretical orientation that they have, then that could be really telling. So an example could be, for example, if you came in and you wanted help with chronic pain management, right? You have a lot of neuropathic pain, and that's getting in the way of everyday activity. It's making you feel really depressed. It's draining you. And even if that psychologist has experience in MS, but they are not well versed in treating pain, that might not be a good fit. So, I'd be very clear about sort of what it is you're looking to get out of therapy. Share that with the therapist and find out if that aligns with their areas of expertise. Similarly, things like history of trauma. So if people have had a history of trauma in their background, or even if you have medical trauma, if the person doesn't have experience with trauma interventions, that could be a reason to switch therapists. So I would want to know sort of like what their bread and butter is, like what. And I might even ask, what kind of patients do you like to treat the most, or what do you think you do the best? Like, where do you think you are the most successful with clients? And that could give you a hint as to whether or not that's a good fit.
I had a friend that was seeing a psychologist, and she really wasn't getting what she thought she needed out of that person. And I said, is that person that you're seeing, do they have familiarity with, she was recently diagnosed, do they have familiarity with multiple sclerosis? And she says, no, but she's a really nice person, but I just don't think I get a lot out of the therapy sessions. And I said, well, you need to maybe think about that and do something about that, because you're wasting her time and your time. And what I found is some people were really hesitant to tell those therapists, like, you're not the right fit for me. They didn't want to break off that relationship. So for the record, does a therapist such as yourself or a psychologist such as yourself, are you offended when a client says, this isn't going to work for me?
Not at all. Not at all.
Okay, so there you have it, folks. I'm telling you, they don't mind.
Absolutely. And I would say, like my goal, and I've said this actually in different other interviews and also with patients one-on-one is my goal is for you to get better. My goal is for you to get what you need. And my goal isn't for you to just sit in that seat and continue coming if you feel like it's not useful to you. So that would not, I would feel bad. I would feel terrible if I found out, months, even sometimes years later, that somebody was just coming because they felt too afraid to break off that relationship. I also would say that the therapist has some kind of responsibility too to sort of check in every so often and say, is this working for you? Is this kind of what you're looking for? And see whether or not you're continuing to make progress in the way that you want to make progress. So I think it's very important to share that. I would say 99.9% of therapists or people that I've met who do therapy would not be offended at all.
Oh, that's excellent. So, and your point of a therapist reaching out and basically saying it's time to move on is really fantastic, because that actually happened to me. So the therapist that I had that was really, really good, very familiar with MS, was part of the clinic and was a huge part of me being able to manage this disease in some capacity. I would not say it's been greatly successful, and not by no fault of his and by no fault of modern medicine. It's just a difficult disease.
Yeah.
He called me one day after us being together for 3 years, and we used to meet every week. And he says, how are you doing today? And I told him. He says, you know what? I think we're done. I said, what do you mean you think we're done? What are we talking about here? He says, you're done. You're done with your therapy. He's like, I've reached a point where I can't take you any further than this. And if you want to continue therapy, you can go find somebody else that you feel like has more value. But you've learned what I think you need to learn, and we've met our whys. So when we first set up that meeting, he asked me, why this, why that? And in business, I'm an entrepreneur, and we always start with the why. And I saw Dr. Boster, who's a neurologist, talk about the why. And when we answered the why, we both came to the conclusion that, like, yeah, I think I am good. Like, I went there to deal with my MS, and I got the tool set that I needed, and I started implementing it, and we saw progression, and he kept copious notes, which I didn't even know about. And he busted out this notepad that was 30 pages long that had every conversation we'd ever talked about. And he said, here's where we started, and here's where we've ended. And we did this like post-mortem meeting. And I'm like, wow, that is really powerful. Like, we made a lot of progress. Sometimes I think it's hard to track that because you're just talking all the time. But it was incredible to see where we did start, where we ended. And it was, I think, just fantastic. And I was surprised to know that you end these things, but that was knowledge to me, and educational. And he was right. So there's a beginning to an end in this process, as I understand it now.
Yes. Yeah. Just a comment on that. I think I also think it's helpful for people to hear that if your therapist or psychologist, like in your example, comes to you and says, hey, I think either we've met the goals that you came in for, or we've gone as far as my skill set will take you, or, I really think it would be helpful if you worked with this other kind of mental health provider because it would get to this other facet that maybe I don't have the experience in. That I hope that also people can hear that that's not the person who's just trying to get rid of you, right? I do think that a lot of times it's hard to break off a good therapeutic relationship because, I get fond of the people that I work with, and I hope that they are fond of me, and that relationship is we use that relationship to grow, emotionally and to learn the skills that you need to get to the place where you want to be. And I also want to make sure that, for example, if somebody needs a couples therapist, because now we're primarily talking about relationship issues, and the individual issues you came to me for are not no longer prominent, but these issues over here are, and a couples therapist would be the best one to take you further. It is the right transition. It is good care. So you wouldn't want to go to a podiatrist to treat your MS, right? So you wouldn't want to keep seeing the same person just because you like them, if they're not going to do the thing that you need them to do to progress further in your mental health.
Yeah, that's great. And we actually ended up, by his recommendation, seeing a couples therapist, but she was not familiar with MS. And though she was familiar with trauma, I would say it was marginally helpful. But if you could find someone that knew the impact of chronic illness on a relationship, I think that would be hugely beneficial because it is a big strain. I have to tell my wife, I'm like, we have one kid, he's 8 years old. MS is like another kid that's never growing up. It just constantly comes and throws a wrench in the engine all the time in the relationships and the work life and all that stuff. Um, how do you deal with that? And ultimately, it's up to the person with MS to figure out how they deal with that. So, one of the questions I wrote down here is what kind of questions should a therapist be asking an MS patient in a first meeting? And I think you kind of touched on that when we talked about what should the MS patients be asking the therapist. Was there anything you'd like to add to that? Because are there any things in there that might be red flags if those people are not, if that therapist is not asking those questions to get to know the individual?
Yeah, so I would say each therapist is a little bit different, and it may depend on their theoretical background, what that first meeting looks like. Um, I I personally will do sort of what brought you here today, like why now, and what are you looking to get out of these sessions? What's your goals? And then I will go into like what is your mental health history. I'll also go into family history, family of origin kind of questions, and then also ask. I do a pretty extensive medical background interview, right? So, what's your sleep like, pain, fatigue, bladder issues, sexual dysfunction. I do a pretty extensive medical background, kind of interview as well, because I think those things are just as important. Um, and I would say that, as a I was trained as a health psychologist now with specialization in MS, but I often always want to get people medically assessed for different things before we attribute them to mental health. So I really want to know all the medical stuff, who you've seen, what medications you're taking, so that I'm not attributing a mental health issue to something that could actually be treated medically. Kind of an example of that might be somebody who takes a steroid and has a manic episode. That actually is quite common for people with MS, or even a hypomanic episode, which is not quite manic, but kind of a little bit heightened or a little bit irritable or things like that. So I want to know, when's the last time you took steroids, or do you get steroids with your infusions? And what are your emotions like around those times? So I think it's helpful if the person that you're working with understands your medical history as well.
Oh my gosh, where were you when I was going through this? That's amazing. Like, yes, and I think my therapist that was part of my university program that was it was a new school of neurology. And they were trying a bunch of new stuff, kind of progressive in that way. And one of them was providing a therapist when you get a diagnosis. One thing that he had that was really advantageous is he knew my doctor, he knew my neurologist, and he knew the relationship we had. And there was a time when I said, I don't know if this particular DMT is working out for me, because I guess I get it. And then the next couple of days, I'm just a really horrible person. I am so uncomfortable in my own skin. I asked him, I said, is this MS, or is this the DMT? Is it the steroids? Like, what is going on? And he would go bounce information back and forth between my doctor, my neurologist, himself, and myself. And we could come to a conclusion with a lot more information and things like, yeah, people that take that specific DMT because of the steroids they have to take with it, as you just mentioned, kind of make them feel kind of crappy for the first couple of days after the infusion or whatever it is. And here's what they've done instead. And this is kind of off the topic, but one thing they said is after you get your infusion, ask the nurse for a bag of fluids, and it'll really help smooth things out the next day. And it took me about 4 infusions before I learned that. And it made a huge difference. The next day I felt really good. So that level of communication was very, very powerful. So I love that you're looking at like the medical history. Wow, I wish they all did that, but they
Yeah.
don't.
I will say the one downside of telemedicine is that I don't get to have those relationships like I used to. So when I was at University of Washington for my postdoc, I was housed in their MS center, and I would have similar conversations. So somebody came in one day and they had fallen, and had were telling me about the pain, the fall, and the pain, and the anxiety they had around walking. And so I was like, hold on a second. I went and grabbed one of the nurses and brought her over and said, can you just take a look and make sure that this doesn't need to get checked out further? And that's really nice to be able to do. The benefit of telemedicine is that we can see people all over the country, and it kind of maybe widens access. But the downside is you don't necessarily have that quick communication like you do in an academic medical center. But I will say another, maybe going back to your previous question, another thing to keep in mind is your therapist willing to reach out to your medical team? That is high on my list, right? I do try to communicate with the neurology team or nursing staff or whoever I can get in touch with, when I have concerns about things, or I have questions about whether this is something that needs to be medically treated, before I start attributing it to mental health. So I would, is your therapist willing to reach out to your medical team? That's important.
Wow, that's fantastic. I'm going to write a bunch of these questions in the description below, so people can think about these. We're running out of time here. Got about 5 minutes left, only because I'm too cheap to pay for Zoom right now.
Sure. No.
But I wanted to, and I didn't write this down as a question, but I want to ask you this because I found it to be very helpful in my situation, both with my wife's cancer, both and with my situation, with my condition. It's a two-part question. Number one, how important is it that someone comes in with a pretty detailed journal of their experience to date? And the second part of that is, should they bring a spouse or an advocate with them to a psychology or mental health session? Because what I do is I bring my wife with me sometimes, and she can provide a lot of information to my care team on the other side that I might not necessarily remember or even know about. She could say stuff like, his talking is getting a lot more jumbled. He's not sleeping as much, stuff I'm not even realizing or recognizing. That seems to have some value. Do you recommend that?
Yeah. The first part of your question, a journal, I think those are also are very helpful. It's helpful for me to sort of have a timeline and also to see what you're experiencing. There are also lots of psychologists and therapists that will have you do different types of journaling exercises in therapy, and to track different symptoms or to kind of track what you're thinking about and things like that. So if that's something that you like to do or it's helpful to you, I would bring that up as I think most psychologists would be thrilled to have somebody who'd be willing to do some kind of home exercises. Okay. In terms of bringing family members in, I'll just share my bias. I was trained as a health psychologist and as my doctoral program, and a rehabilitation psychologist in my fellowship and beyond. And rehabilitation is basically, PT, OT, speech, physiatry. And one of the philosophies of PM&R is that family involvement is key, because, we have the things that we can do individually to make ourselves better. We have the medications that you can be on and the different kind of medical interventions. And then you have your environment. So if you go see a PT and they're asking you how many steps you have to go up to get to your home, all those kinds of things, your environment has a huge impact on how much the symptoms that you're experiencing are impacting you. And I would say similarly, my bias as a rehabilitation psychologist is that I think environment plays a huge role in how we feel. And our families are part of that. So if I'm telling you to make some changes and your wife is not on board or your kid is not on board, and they're pushing back on those changes that you're wanting to implement, that's going to create conflict. And it's also going to be less likely that you make the changes that might be most helpful to you. So if you have a family member who comes in and joins in every couple of sessions, just so also I can get a bigger, clearer picture of what's happening at home, but also so they can be on board with what we're talking about or what we think might be helpful in terms of modifying things at home to make your mood better, then that you have a much higher likelihood of success. So yeah, I love it when family members join.
Thank you so much. And with that, we're kind of out of time, but I really enjoyed this. I think we've gotten a lot of wonderful information out of you. And if you're willing to be on the show some other time once we hit 1,000 subscribers, I would love to have you back because I think this is a huge component of dealing with MS. And you're definitely publishing a lot of stuff and giving a lot of talks, I think, are just so relevant to helping us understand how we navigate this disease with a tool set we carry around with us all the time. And so I very much appreciate it. Thank you, Dr. Beier.
Thank you for having me. This was wonderful. I really appreciate it. And I'm happy to come back anytime.
Awesome. Thank you so much. Anyway, I'm Cliff. This is Life with MS. And until next time, I'm out.